So I always start with this slide. Why digital? Kind of these are four basic concepts here. Probably the biggest thing is just the perception of your practice and setting yourself apart from like a patient, like a consumer's perspective that might be thinking, why your practice? Why should I stick with this doc? We see quite a bit, in the past where maybe price is a little bit more of the only thing that a patient can determine. If two doctors just look the same and there's no difference between them, well then maybe price becomes a shopping comparison tool for patients. But if another doc in your area can't replicate your level of expertise and your presentation through the digital process, even if it's just the treatment planning and the presentation in the consultation, and the other doc can't replicate that, price then becomes secondary. So the goal is to set yourself above with your level of expertise, and digital is a good way to do that. And it might be just as simple as when you tell a patient you need an implant, just verbally tell them, walk them through the process. We scan your bone, we scan your teeth, we design a surgical guide so that, I tell patients sometimes, I could put your implant in with my eyes closed. Not really, but the guide, you're selling the value of the guide. Of this guide is going to lock the drill in for the perfect angulation and depth so that that implant is in the safest position, the most ideal position. And you're building value that not all two implants are the same. There's a big difference in the outcome, and you're trying to build value into the whole digital process. So you get that accuracy, the predictability. We all want that as clinicians. We want to be predictable. We want to get to that, to that next step, to the end stage, and be like, I'm so thankful it was predictably put right where I want. You just take off some of that stress of what that surgery is going to be like. Like yesterday, I did a big case, and I had the patient's maxilla already printed. I had my guide ready, and I was fitting it on and off, and I was looking at the bone, holding it in my hand, walking through mentally that surgery, just getting prepped for a tough surgery. And it was it's very helpful because then walking into surgery, it's like I've kind of mocked the surgery already in my head, and so it gave me a lot of just confidence and takes some of the stress off. Cost, so if you can bring things in-house, you can save on cost. Stock or tie bases versus custom abutments. When we can, change that little workflow, we can reduce costs in our practice. So there's a lot of little nuances and costs that we can tweak. And then the convenience, everything is stored in the cloud digitally. So for the patient's lifetime with that practice, you can go back and access those records. You can bring back after you place implants, you come back and load the cone beam in with the original case, overlay it, and then see where the implants actually ended up, and then tweak your prosthetic. So a lot of cool things you can do just on the convenience side of things.